If you've ever found yourself racing to the bathroom at the most inconvenient times, you're not alone. Today, we're diving into a topic that many people face but few openly discuss: urinary urgency, and sometimes you ended up leaking. But don't worry, I'm here to help you with my strategies to help target the urgency feel on your bladder due to weakness and tightness of our pelvic floor. My name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be talking about urinary urgency, and sometimes with leakage can be a real challenge. But the good news is there are effective strategies that I could teach you right now to finally regain control. Let's break it down into three main categories. First, behavioral therapist, lifestyle changes, and lastly, core control breath work, and how to release, not just doing Kegels, but actually most of you might be doing Kegels, and there's actually a best strategy right now. It's called reverse Kegels. First up, behavioral therapy. One of the most effective methods, no matter how much you exercise your pelvic floor and strengthen your hips, your glutes, and core, imagine this: setting a bathroom schedule like every 2 to 3 hours is very difficult. Most people with ADHD or very busy with their lifestyle, with your work. Most teachers, nurses, doctors, they forget to use the restroom. They're holding their pee at least 6 hours sometimes. And that's not good for your bladder, good for your pelvic floor. It creates spasming inside even though there's no pain, and that's why when it's so full, your bladder is overstretched, you can't make it to the restroom. And that sudden urge hits, don't panic. Here's what you can do: sit down, take a deep breath, and gently prevent that squeezing. Don't squeeze your bladder, don't do the Kegels. Actually, it's reverse Kegels, and today I'll show you how to do that breath work. And then after you've been doing your strategy of making sure you're urinating every 2 to 3 hours, this is a habit that you've been formed for many years. It's time to really try to focus on making a schedule. I know it's like potty training 101 again. You can use your phone and make alarm reminders. Example, if you wake up at 6 a.m., then go ahead, put a reminder around 8 a.m. to go use the restroom. Do this every 2 to 3 hours, averaging 6 to 8 times a day. Once you start doing this, your urgency will start slowly going down, and you're still very weak, so it could be very hard for you and difficult to start changing your training. It takes sometimes 21 days to a year for a habit to change. So if you're really serious about changing your habit, then do this right now. And once you start doing that strategy, then you can start implementing proper fluid intake. Most patients who have urgency is actually sometimes dehydrated. So make sure you're drinking at least 60 ounces to 80 ounces of fluids. So how do we do that? 60 ounces if you are indoors, you're not working out much, but 80 ounces for those who are sweating a lot, working out, so you're well hydrated. It decreases the spasm on your pelvic floor. So the next reminder is you want to make sure you're not drinking caffeinated drinks and all of those irritants. I'll put the PDF down below. You can access this free PDF file, write your name and email address, and access these irritants. Know about what are the things that could irritate your bladder and bowel. No matter how much you eat healthy, if you didn't even realize some of those drinks and food could cause irritation on your pelvic floor. Lastly, we want to make sure you're sitting properly in the toilet. There's a lot of reminders on proper pooping position with the squatty potty. Also check out down below on how to do proper toilet positioning in the PDF together with the irritant. So fourth reminder, I want to make sure you are releasing the tightness on your pelvic floor. Most of the ladies will just try to suck your stomach in and squeeze as hard as you can. So what you're actually doing, you're actually squeezing your bladder and your urethral orifice starts opening. So that creates more urgency sensation. So secret sauce of proper Kegels is actually holding your poop. So what's holding your poop? You're holding your poop is your gentle, not clenching, but gently squeezing your rectum. Pretend you don't want to poop. And that's the first step, finding and knowing how to squeeze without using your stomach, without using your butt cheeks, and without holding breath. And when you're doing hold your poop, you want to make sure with those with urgency, you don't start with that. You actually want to start bearing down, pretend you want to poop. Gentle release first before doing Kegels. So reverse Kegels is more important actually for most of my patients. If you never heard about reverse Kegels is actually opening your rectum and your pee hole without holding breath. So what's holding breath? When you do Valsalva maneuver, which is holding your breath as you bulge or bear down. So if you don't know how to bear down, it's actually important learning how to open that out. You can actually check yourself with a mirror, opening your legs apart, and see if you're bulging out. You can also use a soft ball, place it on your sitting bone, and do a gentle breath work with this. So in this video, you will need a soft ball, a physio ball, and a foam roller to release the tightness of your pelvic floor. So this is very crucial. No matter how much you do Kegels, and most of us will use the ab muscles to do Kegels, and that's really not good for our bladder. Our bladder sits on top of our pelvic floor and also is close by to the pubic bone, behind it, and lower abdominal muscles. So if you're doing Kegels and you're sucking your stomach in and you're not zipping it up gently, you ended up sucking your stomach in, that will create more pressure in your pelvic floor and your bladder. You might start squeezing it out instead of making sure you're focusing at the back. So that's why I have my soft ball, place it underneath your sitting bone. You can feel the sensation of your pelvic floor. Now you can do a gentle, instead of squeezing first, I usually start with breath work. You take a deep breath through your nose. As you inhale, exhale, you make your belly push out. When you're doing that, you're giving space on your pelvic floor. Diaphragmatic breathing is when your diaphragm goes down and your pelvic floor gently releases. As you inhale, you're slowly expanding your diaphragm and then your pelvic floor stretches. So you're alternating back and forth. You're gonna feel a downward pressure towards the soft ball. If you can do cross-legged position, you can sit on the chair, place the soft ball underneath on your pelvic floor like this. So reverse Kegel, place your hands on your lower abs. Inhale, exhale, push your belly out. And then imagine you wanna fart. I know, it's easier for women to find the rectum, not the vaginal canal. And that's the mistake of most ladies. They're trying to squeeze their bladder and their pelvic. Instead of really closing their pelvic floor, they ended up squeezing the bladder. And that will create more urgency feeling. There's different types of leakage actually. There's incontinence because of stress incontinence, because of weakness, and there's also the urgency incontinence. And most of my ladies are combination, but some ladies, they don't have that urgency feel. They're more relaxed on their lower abdominal area. So that's why if you have a C-section, massage that C-section scar. That creates pressure on your pelvic floor. So if you're very tense in your life with anxiety and stressful situations, you ended up sucking in. Most women, they love to pull it in to hold their stress. We need to learn how to breathe out and open that rectum out. Inhale, exhale. Now, as I exhale, I want to really make sure you're mindful of pushing it out. Pushing your belly out all at the same time, really thinking about pushing against the soft ball. After doing 10 times of doing that, your against gravity is easier to find. You're going to feel some more pressure on your vaginal canal now sitting on this. This will help relieve pressure on that over tight pelvic floor. Breathe in through your nose. You don't want to use your chest, but actually diaphragmatic. And as you breathe out, you push your belly out and imagine you want to fart, bear down, or poop. Inhale, exhale. Bear down. Don't do Kegels yet. For those with urgency, try to do reverse Kegels. Inhale. So the ball gives me a reminder to push against the ball as a proprioceptive feedback, mind-body awareness. Do that 10 times. Once you do a lot of reverse Kegels, as you breathe out, push your belly out, don't suck it in. Your bladder is sitting here in front of you, so you want to make sure you bear down. Inhale, squeeze gently. Now you can add regular Kegels without sucking your stomach in. Remember, you don't want to use your back, you don't want to use your abs, and you don't want to use your breath. Just gentle squeeze. Imagine if you have something on your rectum, you want to lift that inside of you. Just gentle squeeze, like a blink of an eye, you barely feel it. That's the right way of Kegels, not sucking it in. Gentle squeeze on your rectum, pretend you don't want to poop, and then bear down. Breathe out to help you bear down, because you are very weak right now and usually very tight. We want to make sure you really exaggerate the breath work. Don't hold your breath. Valsalva is not good for pelvic floor, or else you're going to push out your bladder. So inhale through your nose, And then as you want to bear down, pretend you want to poop or fart. As you inhale, gentle squeeze. But don't combine the breath work with Kegels. You can just Kegel real quick and then breathe out. You can see my belly is pushing out. You can place your hand on your abdomen for that reminder. Squeeze and bear down. And do that 10 times. After doing that with a soft ball, you can also do this on a higher seated ball. So we're gonna sit up now. So sitting on a soft ball will help you engage your pelvic floor again. That mind-body awareness. And want to do proper breath work. As I said, inhale, exhale. You can use your hand to press that breath work. Inhale, push your belly out. Exhale, press. I'm pressing my pelvic floor down to bear down, not sucking it in. Inhale, gentle squeeze, and bear down. You can push your knees out for that deeper stretch. Most patients with urgency, they're very tight on their hip adductors, and these are the mirror of your pelvic floor. What do you mean by the word mirror? The same fascia system on your pelvic floor is the same fascia on your hip adductors. So this is very important. Inhale, exhale, bear down. I'm pushing my belly out, pretending I'm gently bearing down to our pelvic floor. And do that 10 times as well. And the last progression is actually sitting on a soft foam roller, making sure you have a soft foam roller, not a hard one. If you need a soft foam roller, you can check out on the link below. Thank you. On the description below. This is advanced level. If you have pain during intimacy, be careful on this. So as I'm sitting on the soft foam roller, I'm gently releasing the tightness on my pelvic floor. So inhale, so it's like a deep squat. If you can't squat all the way down, don't do this. And bear down. I'm pushing my belly out, sitting on the foam roller right now. You can see. And the stronger your breath, the better. So making sure you're standing straight or slightly lean forward for a gentle release. Reverse Kegels. After doing a lot of reverse Kegels, one in the morning, one in lunch, one at the bedtime, you're slowly releasing the tightness of your pelvic floor. And that's the most of my patients with urgency. You can also massage your abdominal area, because most of my ladies are really grabbing tight on their lower abs. You can gently massage that area. Separate your lower abs against from your pubic bone. It's common for my C-section ladies, as well as for those with a lot of abdominal scars from different surgeries, from hysterectomy, removing of the gallbladder, or appendectomy. So those are my guidelines for those with urinary urgency. This is different from those with stress incontinence, which is when you laugh, sneeze, and cough, you have a leak, but they don't have an urgency sensation. But I have ladies, they have both. We call it mixed incontinence, which means they have the urgency and the stress. So those are different types of incontinence and urgency. You might not be leaking yet if you just have the urge sensation. So you want to make sure you don't end up leaking. When you start leaking already, then you are getting worse. It usually starts with pain, and then urgency, and then weakness with leaks. So I'm hoping you learn a lot on how to target these behavioral changes, lifestyle modification, bladder retraining, decreasing your irritants, enough fluids intakes, making sure you pee every 2 to 3 hours, and learning reverse Kegels. Focus on reverse, not Kegels alone. And once you start learning how to open, then you can do gentle Kegels. So how do we do Kegels? Gentle squeeze, imagine not to poop. Remember, the rectum supports our bladder as well. That's why if you're getting constipated and you're not eating as much fiber, there's more pressure on your rectum, on the colon, presses against our bladder. So making sure you poop every day, especially in the morning, is the best time to poop. Relieve that compression on your bowel and your colon by eating at least 20 to 40 grams of fiber a day. So usually I eat a lot of fiber-rich food, fruits, vegetables, And as I said, there could be some fruits and vegetables that's harming our pelvic floor, that make us gassy. So gassy food makes you have more pressure, and you want to make sure you're well hydrated. If you're eating a lot of fiber, you're not drinking much water, then you're getting constipated as well. So I also take some fiber supplement like Benefiber or psyllium husk. You can check them out, learn more about how to take those fiber every day. Okay, my friends, I'm hoping you learned a lot about urinary urgency, and there's so much more to share inside my channel. If you want to learn more about Pilates, yoga, and physical therapy, please subscribe to my channel, ring the bell so you won't miss anything, like and share this video. Every like you're giving to my channel, you are supporting me. Urinary urgency can really be life-changing once you fix this problem, and I'm hoping these effective strategies, you can start implementing it right now, so you're going to start feeling better as I break down all the categories from lifestyle medication, poor engagement, and decreasing your irritants and proper fluid. If you're still suffering, I recommend you to see your local physical therapist or your doctor. Talk about other strategies from Botox injections and hopefully no surgery, because I do believe on bladder retraining. Imagine this, now you can make it to the restroom. You don't have to rush to use the restroom. You can gently release the pressure instead of Kegels, but reverse Kegels. And then you're training your bladder better. So these are all my urgency suppression techniques that you can start today. So make sure when that sudden urge hits you again, don't panic. You know what to do. You have the tools and reminders now on what to do to make sure you can make it to the restroom without leaking. And this is a game changer. Make sure you learn reverse Kegels, and once you learn how to relax and stretch those muscles, then you can do Kegels to strengthen. And that secret sauce is not about holding pee, but holding your poop and bearing down, pretending you want to fart. Back and forth. Always remember, when you hold your poop, you're also holding pee. Those three holes, pee hole, sex hole, and rectal hole, they always open and close at the same time, which is crazy amazing, right? Think of it as like giving your bladder a little vacation. You don't overthink it. Your body and your bladder will start processing this, and that's what we call autonomic response with the breath work. And don't forget about the Kegels exercises we learned today. Kegels and reverse Kegels. Start with reverse Kegels first, and then Kegels. Learn to stretch that hammock-like sling muscles to go down first before you squeeze. Before you lift, you go down first. And it's not about going down doesn't mean you're leaking. Going down is just gently eccentric control, stretching the muscles. But for those of you with severe cases, options also like nerve stimulation, Botox injections, and other medications to help decrease the overactive bladder. Of course, I don't want you to depend on those things. There's always techniques like this one. You have to start these strategies I gave you. So whether it's through behavioral strategies, lifestyle modification, drinking enough fluids, making sure you have enough fiber, proper toilet positioning with a squatty potty. There's more inside my channel to learn from me. If you found this video helpful, don't forget to like and subscribe my channel, ring the bell so you won't miss anything. Share this video to your friends and loved ones who will benefit from it. Comment down below for any more video requests if you want to do a follow-along video exercises with me. So these are just simple tools you can do, proper breath work, and then you can do your core exercises. Until next time, so let's begin the reverse Kegels using a ball. Place it underneath your sitting bone, cross-legged, or you can, as long as you can tolerate with your knees, it's best to do cross-legged position. Place your hand on your abdomen, making sure you're not squeezing your bladder out by squeezing your stomach in, but gently inhale, exhale, push your belly out, pretend you want to fart. Do that 10 times. Release it first. Always release before squeezing. After 10 times, then you can do Kegels. Pretend you don't want to poop, and then pretend you want to fart. Pretend you don't want to poop, hold your poop, and then you want to fart. Hold your poop, and then fart. Do that 10 times. The next one, sitting on a ball. The same thing, with your knees slightly open to stretch. These are the mirror of our pelvic floor. What do you mean the mirror? The same fascia system on your hip adductors are the same fascia on your pelvic floor. With slightly toes out, place your hand on your abdomen, pretend you don't want to poop, and then fart. And bulge down. Push against the soft wall. Pretend you don't want to poop, and then fart. Always remember, when you hold your poop, you're also holding your pee. But pressing your belly out, massage that area if you have tightness on the lower abs, especially for C-section, appendectomy, and those with abdominal scars like hysterectomy. After 10 times doing that, this is the deepest stretch and the advanced level, sitting on a soft foam roller. If you need a soft foam roller, comment foam right now, or click the link on the description below. You can access my soft foam roller. In the deep squat, you're opening really your pelvic floor. If you can't squat yet, don't do this. Do the first two I gave you. So when you're sitting on it, it gives you feedback to stretch and open that area. Hold your poop. Don't use your abs. Don't use your hips. Don't hold your breath. But when you bear down, pretend you want to fart, push your belly out, and that's fine. Hold your poop, and then bear down. As you bear down, you breathe out, pretend you want to fart. And do that 10 times as well. Okay, my friends, I'm hoping you learned a lot. I gave you all the information today. Start today. It's not too late. If you have more time today, watch this video about rib cage flare and this video about SI joint dysfunction. Until next time, always remember, be safe, be well, and healthy you. Bye.